Okay, you are listening to Hall Monitor on WPPM 106.5 in Philadelphia, Comcast Channel 66, and streaming live at phillycam.org. You can find us on Twitter at Hall Monitor WPPM, on our website www.hallmonitor.org, or on Facebook at PHWWPPM. Tonight on the program, our own Lance Haver will take us through a possible ACA insurance rate hike. And in the second half of the show, we will discuss where we are in this election cycle, this very strange election cycle that is endlessly fascinating to me. So Denise Clay Murray is with us as always. Denise, how are you tonight?
I'm good. How are you?
I'm fine, thank you. And Lance Haver, who is taking us through this ACA insurance rate hike. How are you doing tonight?
I'm all right. And I'm going to have some good news as I was hoping for last week.
Good. All right. So, Lance, why don't you kick us off here?
Well, I'm going to call up the first slides. Let me make sure I can get that up with Allison's help. There we go. So I'm going to give a little bit of a background because not everybody gets their health insurance through the Affordable Care Act. So if you're in my age bracket, you get Medicare or Medicaid. Many people who are employed get it through their employer. But for the rest of the people, they end up having to buy it themselves. And it was not affordable. In the bad old days, what was happening was insurance companies were refusing to sell insurance, charging women more, and canceling your insurance if you got sick. So the Affordable Care Act has done away with a number of those things. They can't refuse to sell you insurance because you're sick. They charge women and men the same amount, although they are still allowed to discriminate based on age. And they're no longer allowed to cancel your policy if you get sick. And they must spend at least 80 cents of every dollar they collect on actually covering healthcare. So the recent bill is why we're going over this. And that's the bill that has good news. But the first question many people want to know is, if you don't have health insurance, can you buy it now? And the answer, unfortunately, is no, unless you've had something that's changed in your life. So if you've been laid off, if something has dramatically changed, then you can get health insurance. But if your situation is the same, you can't get it until November 1st, when it becomes the open. There we go. I'm trying to get that up there. But November 1st is when you have an opportunity to buy health insurance through the Affordable Care Act or change plans. So right now, if you don't have it, unless you have what they call a life-changing incident, you can't get it by law. And because of what President Obama and President Biden did, healthcare is now subsidized. Before, again, in the bad old days, there was no subsidies for people who were forced to get insurance by themselves. And many people realize, but I want to say it again, that when you buy health insurance by yourself, it's much more expensive than when you buy it in a group plan. So people who are forced to go out and buy insurance by themselves, either because they were independent contractors, people in the gig economy, had employers that refused to buy it for everyone, or for whatever their situation was, they were being hit with massive premiums. And so the Affordable Care Act has changed some of that. It's not all good news, we're going to see, but it's really helped literally millions of people get it. So who gets the subsidy? The subsidy is tied to income. And there is a Medicaid, which is a low-cost policy for anyone who makes 138% of the federal poverty level. Now, we're going to see that's very poor. But anyone who makes up to 400% of the federal poverty level is going to be able to get some subsidy. And, while it's hard to say it out loud, the federal government has a very low threshold for how poor is poor. To be poor is very poor. So according to the federal government, if you make $13,600 a year, you're not poor. If you have a family of four and you make $28,000, you're not poor. Even though we know that you're really not able to pay for rent, utilities, food, insurance at these prices, but the federal government continues to use a very old formula to figure out what the poverty levels are. So the Affordable Care Act, understanding that, has said you can get subsidies up to 400%. So just to put it in perspective, if you are a family of three, which is really where things are for a lot of people, and I'm just calling up my calculator now. Family of three, if you make $92,000 or less, you will get some help paying for your health insurance. It's still going to be very expensive, but it's not as expensive as it would have been. So what's the average? The average continues to be held lower because the American Rescue Plan, the amount that was set aside during COVID, increased the subsidies for health insurance. Now, that was going to go away until President Biden and the Congress passed this new law. And now those subsidies that have been put in place, what's called the American Rescue Plan, which most of us know as stimulus dollars, are going to stay in place. And so that means that people will continue to get these tax credits. And I understand it gets confusing, so I'm going to go through it quickly before we start talking about what people face. You go to get insurance based on your income, you're given a tax credit. And that tax credit can be used to lower the premium on your health insurance. What makes it a little tricky is at the end of the year, you have to do what's called a true-up. They have to figure out if you owe the health insurance company money or the health insurance company owes you money, or if you were laid off during that year, if something's changed, you may have money coming back to you. And it shouldn't be a surprise that most of the time, the insurance companies owe people money. But the formula, the way that it's set up, is very difficult for most people to understand, very cumbersome, and ends up with over collecting from some people who are struggling and would be better able to use the money every week than to get an $800 check at the end of the year. The average tax credit based on a family making $50,000 a year is $365 a month. Now, it's hard to say what your health insurance would be because there are many different plans, and depending upon where you live, the rates are different. So you can get what's called a bronze plan, a silver plan, a gold plan, or a platinum plan, and they all have different formulas and they all have different amounts of copays. So it's almost impossible for me to say what the average amount anyone's paying is. In addition, if you live in Philadelphia, because our healthcare and our living expenses tend to be higher, you may end up paying more than what you're paying in Elk County. Of course, the amount of doctors and hospitals and research facilities in our area is much higher than what's in Elk County. So the quality of your care may be a lot better here in Philadelphia than it would be in Elk County. So that's why I can't say what plan will cost what. In addition, even if you do your research and even if you do a thorough job of trying to figure out which of those plans is best for you, it's still tricky because as this comes from the insurance commissioner's office in Pennsylvania, the health plan's list of providers changes daily. Call your doctor or provider to be sure that they belong to the health plan you choose. So what that means is you can have a relationship with your doctor, with a hospital, with a clinic that you feel very good about, and the health insurance company that you sign up with may decide they no longer want to include that doctor, that clinic, that hospital in the plan you've picked. And you can only change your plan once a year. So it's a very difficult thing. And again, it's one thing to say that the Affordable Care Act is a tremendous improvement over the bad old days when insurance companies could spend whatever they wanted on perks, whatever they wanted on lobbying, whatever they wanted on marketing, whatever they wanted on salaries. Now they have to pay at least 80% of every dollar they take in on actual health care. Saying all those improvements doesn't change the fact that this is far from perfect, and it really creates a number of difficulties for people who are trying to get health insurance. Affordability is one, coverage is another, and finding the plan that suits you is a third. In the last 2 years since COVID, the insurance companies have had a tremendous windfall. They've had a windfall in car insurance because during COVID, people drove many fewer miles. Pennsylvania is one of the fewer states that didn't order mandatory reductions in car insurance. California ordered mandatory across the board 15% reduction in car insurance because when people lost their jobs, when people weren't going out, when people were working from home, they didn't drive as much, and therefore there are fewer accidents and there are fewer payouts. And the insurance companies had this tremendous windfall. In addition, insurance companies got the great tax break through the President Trump's administration, and they didn't lower their rates, even though they were paying far less in taxes. So we have seen that some states actually are proactive in forcing the insurance companies to follow what's going on and lower rates when it's appropriate. Pennsylvania isn't one of those states, but during COVID, this is from the American Medical Association Journal, the amount of people going to the doctors, going to the hospital, going to the clinics had dropped precipitously. So 29% missed a preventative care visit, 26% missed an outpatient general medical appointment, 8% missed one or more doses of prescription, 8% missed an outpatient medical health appointment, 6% missed elective surgery, and 3% didn't receive health care for a new severe mental or physical health issue. Now, there's a human cost to all this, and it's devastating for people who don't get the care they need. And that would be a discussion for another day. I'm just talking about dollars and cents. All of these missed appointments, all of these missed treatments, all of these missed opportunities for people to get healthy saved the insurance company literally millions of dollars. So they're collecting rates based on what was. And now because of the COVID, people aren't going to the doctor, aren't getting prescription filled, and they're paying out, the insurance companies are paying out far less. And our insurance commissioner didn't order across the board rate reductions. What has happened though is the rebates. Again, as I talked about earlier, every year there's supposed to be what's called a true-up. The insurance company is supposed to look at how much they collected and how much they spent and refund all of the money that they over-collected. Now, the Kaiser Family Foundation is a foundation that follows healthcare, and they explain it like this. They say the rebates, the money the insurance companies have to give back, are the result of insurance companies not meeting the ACA, the ACA medical loss ratio threshold, which requires insurers to spend at least 80% of premium revenues, 85% for large group plans, on healthcare claims or quality improvement activities. So again, this goes back to President Obama, President Biden's law that improved healthcare and health insurance, that said insurance companies couldn't write the cost of sending their people to the Super Bowl off and claim that as an expense. They couldn't use more than 20% for overhead, lobbying, advertising, and everything else. At least 80 cents on every dollar went for healthcare. And so that's an improvement. But what that means is when people stop going, when people stop using doctors, stop going for elective surgery, stop taking their medicine, that meant that the insurance companies were over collecting and they were going to have to issue rebates. The rebates, we'll see, should be something we think about when we think about this coming year's rate increase. Where are we right now? Well, as you can see from CNN, we're looking at very large increases in rate increases. As they say, as Americans fork over more and more of their income to pay for rising premiums and deductibles on their health insurance, the major insurance companies are raking in record profits. So we know that the insurance companies have been doing fine, and they've been making literally more money than ever before. And we know that rates are going up, not just from the Affordable Care Act, but also for people who get their insurance through work. The employer who buys the policy may be paying more. They may be passing that on. They may be charging more in the way of deductibles. But at the end of it all, what it means is that the insurance rates are going up, whether it's the premiums, whether it's what the employers pay, whether it's the deductibles, whatever way it's happening, it means the insurance companies are charging more money. Now, I'm going to show a video that comes directly from the insurance department. The insurance department in Pennsylvania is responsible for monitoring insurance rates. And I think that to understand just how hard it is for consumers to get a fair deal, I'd like to show this video and then talk about what's going on. So here it is.
Have you ever wondered how your health insurance company calculates the cost of your insurance? Pennsylvania Insurance Department can answer your questions. In accordance with Pennsylvania law, we review and approve the rates that insurance companies charge individuals and small businesses. We make sure you're treated fairly and that the cost of your health insurance is transparent. A health insurance company calculates the base price of an insurance plan, called a rate, by considering 4 factors: medical costs, which are a function of both how much medical services cost and how often people use those services. Medical costs account for most of the cost of health insurance. Operating costs, or the amount spent on things like salaries, rent, and marketing. Taxes and fees. And profit, the amount that the company keeps after it pays other costs. Once an insurance company adds these 4 factors to calculate the base rate of a plan, it adjusts the rate for each person who buys that plan by applying 4 additional factors. The amount calculated after applying these factors is the premium you're charged every month. The 4 factors that a company can use to vary its base rate are: age. Older people can be charged up to 3 times more than younger people. Location. Where you live affects your premiums due to variations in the cost of living and the level of competition between insurers and healthcare providers. Tobacco use. Insurers can charge tobacco users 1.5 times more than those who aren't users. Family size. Insurers can charge more for a plan that covers a spouse and/or dependents. These are the only 4 factors that insurers can use to adjust your premium. That means insurers can't charge you more because of your gender or how healthy you are. Where do we come in? The insurance department reviews rates for plans to be sold to individuals and small businesses before they are charged to you. Each spring, insurance companies submit rates for the next year. We review those rates over the summer and approve final rates in the fall. Insurers then start using the approved rates on January 1 of the coming year. We consider 4 things when reviewing rates. First, we look at the company's medical costs in previous years and how they estimate those costs will change in the coming year. Second, we evaluate the insurer's estimate of its non-medical costs. Under federal law, insurers must spend at least 80 cents out of every premium dollar on medical costs and activities that improve healthcare quality. The remaining 20 cents can be used for operating expenses, like salaries, rent, marketing, and profit. If an insurance company fails to meet the 80% target, it must pay back the difference to enrollees. Third, we look at the insurer's financial condition to make sure it's collecting enough in premium dollars and has enough money saved to pay future medical claims. Fourth, we always think about the impact on consumers. We look at the insurer's past rate increases and consider whether the insurer could charge less and maintain a sufficiently strong financial condition. We also welcome public comment on proposed rates on our website. Considering these factors, if the proposed rates are excessive, meaning they're too high in relation to benefits, inadequate, meaning they're too low and the company might not have enough money to pay claims, or unfairly discriminatory, meaning they charge certain people more than allowed under state and federal law, the rates aren't approved, and we work with the insurer to modify their request. Remember, our job is to serve and protect you, the consumer. Make your voice heard by visiting our website to comment on proposed increases and check back for information on the final approved rates. Plan options and prices change each year, so shop around during open enrollment. Consider shopping on the Federal Health Insurance Marketplace at healthcare.gov. It's an easy way to compare plans, and it's the only way to get federal subsidies that reduce the cost of your insurance. For more information on how to shop for or use your insurance and other helpful resources, visit our website at insurance.pa.gov.
So I think we can take it back down now. Thank you. So I hope everyone who saw that understands that they never mention affordability. That's not one of the things that's considered when they do a rate increase. They say they're looking out for us by trying to treat the company fairly. But the idea of who can afford it and what's happening with incomes, for example, Pennsylvania minimum wage is at $7.25 and has been now for over a decade. They don't consider that. They don't consider where income is. They don't consider what's happening with rents or utility bills. PECO is going to raise their rates again. That is not one of the considerations that happens. And as we see, that's an anomaly. In other states, that's one of the first questions that's asked. I'm going to pause here for a little bit and see if there are questions, and then we're going to discuss more about what's happening in this year's Affordable Care Act rate increases.
Yeah, Lance, one of the things that I've always wondered about, because you see this with, I think, Medicare and different insurance plans, why is there a period where you can apply or sign up for a program versus the rest of the year where you can't?
So there's two answers to that. The answer is it makes it easier for the people who make the rates. So when an insurance company tries to figure out how much to charge, they want to know how many people are buying insurance from them and what they're paying. So if that number changes during the year, then the rates that were set will not be accurate. For example, if they have $1 million worth of overhead and they have 1 million customers, that means that every customer has to pay $1 towards the overhead. If during the year, half those people switch to a better insurance company or more affordable rate, now they have 500,000 people each paying $1 for $1 million worth of overhead. And they will have a shortfall at the end of the year and then go back to their 500,000 consumers and surcharge them. So it makes it easier for the people who set the rates to have a frozen year to look at the rates and say, during this time, you can't switch. But as most people know, that's not true for car insurance and it's not true for homeowners insurance. So why is health insurance such a different animal that people aren't allowed to shop for better prices? But that's the answer I gave you in the beginning is the reason why. The other answers is insurance companies have a tremendous amount of power, and health insurance is a very difficult product because we don't really want to tell the truth about it. We don't, President Obama did a great thing. It's absolutely true. But still, for literally millions of people in America, health insurance remains unaffordable. And the Democrats don't want to say that. And the Republicans certainly don't want to say that. So we have all of these kind of rules that make it seem like it's affordable. And we don't talk about deductibles. Although, again, in the bill, the federal bill that was just passed, there's good news for Medicare people on Medicare. But there's not good news for people who are in private insurance in terms of setting the price of insulin at $35 a month, making the limit of only $2,000. And I say only $2,000, which is an outrageous amount to spend for medicine, especially if you were to go to Canada or any of the European nations where you don't pay anything for medicine. But it's at least limited to a certain extent. But again, if you're in that category of making $14,000 a year, federal government says you're not poor, but you still have to pay up to $2,000 a year just for your medicine, maybe for your insulin, maybe for whatever you have. So it's a very difficult situation for us. And we also know that, again, you can't say it's true for everyone. We have to talk in tendencies. We know that the poorer you are, the less affluent you are, the more likely you are to live in an environmentally unsafe neighborhood and develop cancers. Now, it's not true for everyone. Just because you live in a poor neighborhood doesn't mean that you will get cancer. But we do know the correlations are there, that people who are living next to refineries or living next to places where chemicals are dumped have, from time to time, what are called cancer blooms. And this is one of the aspects of American health that, again, we have not yet addressed. Saying that, let me see if there's any other questions. If not, I'm going to move on to what we're currently facing. Okay, so if I can pull the slideshow back up, is that possible? Yeah, thank you. So again, just to put it in perspective, in Massachusetts, the Division of Insurance has the legal authority to conduct hearings. You saw that in the Pennsylvania video, there's no hearings, nothing. We can write emails to them, but no hearings. In Connecticut, and I'm not going to show it because it's actually 5 hours long, and it gets very technical, and I'm not going to suggest everyone would be interested. But in Connecticut on August 15th, the insurance department held an informational meeting on the requests for increases in the Affordable Care Act insurance policies. Pennsylvania, there are no hearings, there's no anything. And I would actually say that the overwhelming majority of us don't even know this is happening. And here's the question from the Connecticut Attorney General who's participating in these hearings. His name is Attorney General William Tong, and he asks if insurance companies, if they perform an analysis of whether customers can afford their premiums before requesting an increase. Not only does Pennsylvania not ask the insurance companies that, Pennsylvania says with no uncertain terms that they don't even consider that when they set rates. So what are we facing right now? We're facing some very significant rate increases and some rate reductions. And again, this is where it gets very difficult to explain because there are so many insurance companies in so many different ways. So I just picked a few of the examples. This is the Capital Advantage rate increase. And you see, to make it even more confusing, the rate increases from 8.1% to 18.4%. And we don't know why. We can't ask questions. There's no hearing. There's no way to know. But they're saying that they have to raise their rates by 18.4%. And there's some very surprising things in this filing. They are asking for a profit of 2%. Now that seems like a relatively low profit until we find out that Capital Blue Cross is a not-for-profit. So it becomes a curiosity as to why Capital Blue Cross, that doesn't make a profit, it's not a profit, not-for-profit company, needs to make 2% profit. In addition, the company expects its annual medical costs to increase by 6.32%. Now again, there's no justification for that number. There's no explanation for that number. That's just what their actuaries say. And as I said, Capital Blue Cross is a not-for-profit hospital plan corporation. So I can't tell you why they need to make a profit. I can only tell you that if they had hearings and people like myself were allowed to attend, I would certainly ask that question. As we talked about the rebates, which makes you even wonder more about what Capital Blue Cross is doing. In 2020, Capital Blue Cross had overcharged its customers, its consumers, so much that on average they had to send $800 per member back. But in some cases, they overcharged as much as $3,000. So this means that their projections were wrong and that they had overcharged. Again, if you're making $15,000 a year, being overcharged $3,000 is an incredibly significant amount of money. If you make $300,000 a year, yeah, I guess you don't miss the $3,000. But people who are struggling, who are not doing that well economically, having that money taken out when it didn't have to be taken out is really a hardship. But the reason I'm putting this up here now is I'm asking people to think about this. If we know that Capital Blue Cross overcharged in the past, shouldn't we have a right to ask them whether this rate filing is going to be an overcharge and whether it would not be better to not overcharge people? But because the insurance commissioner won't allow for hearings, we can't ask that question. Geisinger is another healthcare company that sells health insurance. Their rate increase is just under 32%, 31.9%. And it becomes, again, very difficult to understand why they're asking for a rate increase of this size if you can't ask questions. Again, they're asking for a 2% profit. They are a nonprofit. So why do they need nonprofit? But the real challenge is to explain why Geisinger expects medical costs to go up almost 9%, 8.93%, when Capital Blue Cross says they're going to go up 6.5%. That's a very significant difference in terms of how much you're going to charge people. But there is no way to ask those questions. Now, one of the things that Geisinger does is actually publish what's called a 990, which is a form that shows what their executives make. And I'm sure no one's going to be surprised to find out that part of this rate increase is to compensate their executives at a very nice level. So again, this is just proof that Geisinger is a 501c4 and they're a tax-exempt organization. But here is what they pay their executives. It's non-for-profit. The president makes $2,366,833 a year. The chief operating officer makes $2,227,971. The chief financial officer makes $1,679,091. These are the people who are saying that a 30% rate increase is okay. Now, again, I don't begrudge people making a lot of money. And in fact, I think we should have more millionaires and fewer billionaires. I'd like to see more of us become millionaires and fewer of us be billionaires. But I have to wonder, if you're making $2.5 million a year, how sensitive are you to a rate increase of 31%? And I think the answer is obviously not. And that's where we expect government to step in and play a role. But to further compound things is Keystone Health Plan is going to dramatically lower their rates. They say that they can lower the rates by 7.6%, which is great news. They also want a 2% profit, even though they're a not-profit as well. But compared to what Geisinger says, they agree with Capital Blue Cross. They say the rates are going to go up 6.58% in the future. So we can see how easy it is to manipulate these numbers and create a tremendous windfall for the insurance company by simply changing a few numbers here and there. These are the questions, if we had hearings, we could ask. Future costs and utilizations. Are they 6.6%? Are they 9%? What do we know? The favorable experiences of 2021, where we saw rates go down. If we could keep rates down, why now do we have to have massive rate increases? And what are the things that the state can do to lower the need for the rate increases? But without hearings, all we can do is write emails to the insurance commissioner, and those emails, they say, will be posted, as if that somehow will have a dramatic impact on the decision. The department, again, this comes right from their webpage, and I want to thank our viewers for watching us on Comcast Channel 66 and Files 29. You are watching Hall Monitor on WPPM 106.5 FM we're broadcasting. And you can find us and what we're doing here on social media at Hall Monitor WPPM. So thank you for joining us this evening. This comes from the Insurance Commissioner's Office. The department reviews rates to ensure the plans are priced appropriately. That is, they are neither excessive, too high, nor inadequate, too low, and are not unfairly discriminatory. Again, there's no words about affordability.
Excuse me, Lance.
Yes.
Was the law written to not allow people to comment in person on this stuff? Or is this just an arbitrary decision that the insurance commissioner made?
The laws don't have hearings. The laws allow for public meetings. If the insurance commissioner wanted to, he or she could have a public meeting. But I will tell you, when they did that in the past, I brought many people with me to those hearings, and people spoke out. And the last time I went, they actually tried to remove me from the hearing. And so what happens when they have hearings is, health insurance is not like buying a new car where someone says, well, you know what, I'll buy a used car instead. Or says, I can't afford a BMW, I'll buy a Ford. Or I'll buy a leftover, or I'll buy a slightly used car. So when people who are really struggling and have ill members of their family who need care are told that they're not going to be able to afford their health insurance anymore, they show up, they're angry, they speak out, and they ask very pointed questions like, how much is this insurance executive making? So the insurance commissioners over the years have tried to hide all this. They've tried to keep it private. They've tried to say, well, we're going to put it on the web page and you can send us an email. But tomorrow, if they cared, if they wanted to, they could open the doors and say to the people of Pennsylvania, we're going to have public meetings throughout the state, and we're going to ask you what's affordable. What can we do? How can we change the law? How can we be fairer to you? How can we make sure that everybody has health insurance? And we don't do that. Again, I want to put it in perspective. This is vast improvement because of President Obama and President Biden. The subsidies are tremendously important. The expansion of Medicaid under Governor Wolf is a wonderful thing, solves many problems. But for the working poor, for the middle class, these problems have not been solved yet and will not be solved until we address the issue. I want to just go over how bizarre it is. So I'm going to compare what happens if Verizon wants to raise the landline rates in the state of Pennsylvania versus what happens if an insurance company wants to raise health insurance. So if Verizon wants to raise the price of a landline, and I think we can all agree at this point, landlines really aren't that necessary. They're nice. Some of us still have them for various reasons, but it's not something that we need to live with all of the cell phones that are available. But I think most of us would agree we need health insurance for a quality of life. So in the beginning, the phone company files for a rate increase with the Public Utility Commission, and the Insurance Commission files for a rate increase with the Insurance Commissioner. That's the same. From there, it's completely different. Public Utility Commission schedules hearings. Insurance Commissioner, no hearings. There is a public advocate that represents consumers in the Verizon rate case. There's no public advocate that represents consumers in any of these proceedings for insurance rate increase. For Verizon, people like myself, other advocates can intervene. You have a right to be a party, a right to discovery, a right to cross-examination, and a right to challenge the utility company's assumptions. Insurance, there's no right to intervene, no discovery, no cross-examination, or no challenges are allowed to insurance executives' projections. In the rate case for a phone line, going up $4 a month, a written decision explaining the rate hike is given, and people can read it and they can appeal it. They can do what they want. In a 14, 18, 30% rate increase for health insurance. There's no written decision made available. All you can read is a summary. That's all that's provided. And this is something that's very hard to accept. If we have these protections for Verizon landline, why don't we have these protections for people who need health insurance? Now, again, the insurance commissioner says, I'm overreacting. All you have to do is send them an email. So I've put up on our page where you send the email if you believe that that's the best course. I believe the best course is to ask our elected official, our state representatives, our state senators, why is this allowed to happen? Why are there no hearings? Why is no one saying anything about a 29.9% increase in health insurance? Why isn't anyone talking about the fact that some of the insurance companies overcharged so much last time that they had to give $3,000 back? Why isn't anyone talking about how much these not-for-profit executives are making while saying that they have to raise rates by 20, 30%? So I think the correct place to be putting the effort is into our elected officials and asking them, could you stand up for us? Could you refuse the insurance companies' dollars, donations, contributions? Could you stop with that and instead represent us and put forward a real hearing process that allows us to keep rates down? But that may be too much. So I'm going to again say the insurance company says you can send them an email and tell them what you think. I will say the insurance company's filings are online. You can read them. They tend to be about 150 pages. Without some technical expertise, it's very hard to make your way through them. I didn't put them up again because it's just too much for our show, and it's not really helpful because the main thing is how much money are they spending on overhead? They have to spend 80% on healthcare, but they make projections, and we don't know whether they're doing what they can to keep healthcare costs down. Precisely an example. We know that diabetes is a growing problem for all of us. We know that paying money to help people see a nutritionist and eat better lowers the need for insulin, lowers diabetes. Why isn't nutrition being covered? Why can't we see a nutritionist? Why can't we go for some of these lower cost interventions before we get very sick? And those are the type of things that would be helpful for insurance companies to focus on rather than focusing on, we're just going to negotiate with the hospital, we're going to pass those rates along, and when we don't think we're making enough, we're going to raise the rates. So that's my report for tonight. I did go over a little bit, so I apologize, but I do get a little bit angry.
Well,
No.
This is a legitimate reason to be angry. I mean, right now, I have a friend whose husband needs a kidney transplant, and he can't even start the process. I mean, they found a kidney for him. He's on the list, but he can't start the process to, prepare to get a kidney transplant because he doesn't have enough insurance. And I mean, he's on Medicaid of some sort, but it doesn't cover a kidney transplant. And he's on dialysis right now. Now, long-term dialysis almost always leads to your death. I mean, the late Jerry Mondesire died because he was on long-term dialysis before he could get a kidney. And, it's really a shame that in a state where your minimum wage is still $7.25 an hour, we haven't figured out that maybe not allowing insurance companies to price people out of their health care, might be a good idea, especially since, let's be honest here. We are the nation's poorest big city, and with poverty comes health problems. Most of them brought on by our diet because we eat what we can afford. And if you can't afford fresh fruits and vegetables, but you can't afford whatever you can get out of the poppy store, that's what you're going to eat.
I think you said it well.
Lance, I just wanted to ask you, and I don't know if anybody would know the answer to this, but historically, when these rates are filed with the state, do they get changed? Does the state object often, or is it just kind of a rubber stamp?
They sometimes get changed, but mostly they're rubber stamped. The thing that we don't know, and it's very hard for us to follow, is when the plans are changed, it's a negotiation between a secret room negotiation between the insurance commissioner staff and the insurance company. And sometimes that negotiation takes the form of, well, we're not going to let you raise the rates that much, but we're going to let you raise the deductible, or we're going to let you raise the copay, or we're going to change whether you're from a bronze plan to a platinum plan. There are so many moving parts to the Affordable Care Act. And again, very clearly, this is an improvement. The people who want to do away with it are misled. It should be improved, not eliminated. But the people who are trying to access quality health care through the plan, who have limited income, are very to figure out what plan to use and how much it's going to cost. So again, for example, sometimes people have a copay of $300 to go to the emergency room, and it's a $25 copay to go to their doctor. So now you have people who feel like they may be having a heart attack who have to make an economic decision. And that decision can be very difficult because it ends up being something that costs everybody more money and costs a human toll. So it would be nothing for insurance companies to say the following: it's a $300 copay unless the emergency room physician says you should have come here. Yeah, we don't want people who could go to the doc in the box, the urgent care place, or could go to their doctor for a few stitches to go to the emergency room. We don't want that because that costs us all money, and it takes space in an emergency room that should be servicing people who have significant problems. But what we don't want either is to have people decide not to go to the emergency room because they're afraid that they won't be able to make their copay. So it would be, again, just no thought at all to say, if the doctor thinks that you shouldn't be there, for them to then take responsibility for that decision and either deny you access and send you to the urgent care center, or for them to say, I'm glad you came. This is a really good decision for you. Now we're going to be able to have an early intervention, get you healthy, and save a tremendous amount of money on long-term care. Just a concrete example is strokes. We, meaning medical science, now believes we have roughly 3 hours to treat a stroke patient so there's no long-term damage. Now, obviously, it's not always the case, and I'm sure it's not exactly 3 hours, but someone who has symptoms of a stroke, we want them immediately to go to the emergency room to have that treated so that there's no long-term damage, so that they're not in trouble for themselves, for their families, and also for the rest of us, because treating long-term illness in a nursing home is much more expensive than sending someone to the emergency room to have the clot in the brain dissolved so there's no damage. We just don't think about the long-term consequences of our decisions, and the insurance companies set up these copays and make the medicine so expensive that people skip on it. When they skip on their medicine, they get ill and they go back to the emergency room. People who can't afford their insulin don't use all of it, and therefore they have to go back time and time again. And again, diabetes is, as Denise was saying, is one of those horrible illnesses that leads to the kidney failure, that leads to all of these other illnesses, blindness, loss of limbs. All of it goes along, and much of it can be treated if we get to the person early and make it affordable for them to get the treatment they need.
All right,
Or
well,
at the
Lance,
very least, make it obtainable.
Obtainable is the
Right.
right word. Yes, better word.
Lance, thank you so much for walking us through that. Some good news, some not so good news, but we're definitely going to keep on top of that. I wrote a couple of things down that I think we should talk about off the air that we might be able to do to maybe shine a little more light on this. But thank you so much, as always. Now, I'd like to spend a little bit of time on this election we have going on, and I'd like to focus on the statewide candidates a little bit. We have 4 people running for 2 high offices, 2 for governor, 2 for Senate, and I don't think you could find 4 more different people running for these offices than who we have. On the Democratic side, you have Josh Shapiro, who I think is probably the only candidate of the 4 who fits the mold of what you would think a traditional politician looks like.
Yeah.
And you have John Fetterman, who is about 6'8", I believe, and does not look like your typical politician, does not dress like your typical politician, and doesn't sound like a typical politician. On the Republican side, you have perhaps the strangest of all, in my opinion. And when I say strange, I mean that I mean it just as a political oddity. Somebody who was a television star who was also a renowned doctor, and then became somewhat of a dubious doctor, depending on whether or not you believe the products he was endorsing.
And is a citizen of Turkey.
Yes. Something he's been trying to downplay, but he has dual citizenship.
How bizarre is that? Someone running for the United States Senate who has a citizenship in a different country.
Yeah, it's fascinating. And then you have the other Republican, the candidate for governor, is one of the farthest right candidates I think we've seen in a long time in this state. I would say to the right of Rick Santorum. And
Now,
I think that's really
you don't want necessarily.
right. So you have these 4 candidates who all had very different paths to getting here. And I just wanted to really quick mention this. So I was just looking at some numbers today. And this is also something that I think is fascinating. President Biden's nationwide approval is -15. So he's pretty low. A generic ballot, Democrat versus Republican across the country, is about 1/10 of a point in favor of the Democrats. Those 2 things I just said, those 2 numbers usually don't line up. That's usually not the way it is, particularly in the midterm election after a new president gets elected. Usually that party takes a loss. Right now, it's kind of even nationwide. And again, we're talking about nationwide polls in August. Take that for what it's worth. But it's something that's been standing out to me. Fetterman and Shapiro, the 2 Democrats for these offices, a poll just came out today that has them both at least 10 points ahead in what's supposed to be a swing state, and what is looking like a very even election, despite the fact that it probably shouldn't be. What are we looking at here?
Well, I think that what we're looking at is I think it's the I can't remember which comedian it was that described somebody as a habitual line stepper. But I think that the reason why it's so even is because the Supreme Court, which is basically run by Republicans, decided they were going to be habitual line steppers this term. And when you start talking about making people have babies, and you hear people talking about, I'm going to get a proactive vasectomy because they're making people have babies, people start to rethink their choices. Now, in Pennsylvania, I've done stories on Doug Mastriano. There is, unless you want him to make good on his threat to make Pennsylvania, Florida North, that's a non-starter for you. And in terms of John Fetterman, sure, he's ahead of Oz by 10 points, but, and I'm going to say this for fear of ticking off all of Fetterman's partisans, if Fetterman does not come to Philadelphia before before November, if he does not get his behind down here, like immediately, he's going to lose. And the reason why he's going to lose is because all of the people that would normally get, particularly the Black community, into the polls, they're not hearing from him. He's not talking to them. The whole primary season, he pretended they did not exist. And if he does not correct that, like now, like yesterday, if he does not correct that very, very soon, he and his partisans are in for a nasty surprise.
He needs to be holding rallies here in Philadelphia.
He needs to come here because he has ignored where most of the state's voters are for far too long. He has decided, for whatever reason, that the phrase working class does not apply to us, that it only applies to the people out west, the people that don't mind that he shows up looking like an unmade bed to talk to their mayor or whatever. He needs to come here. If he's serious about becoming the senator, he needs to come here. And if he doesn't do it and he loses, I don't want to hear it from anybody because they brought it on themselves.
Well, that's right. That's right. You have to campaign in the southeastern part of the state, not just Philadelphia, I would say. I would say that the 5-county area as well. But you have to be here.
And you have to get closer to here than Bucks.
Yeah. Yeah.
Which is as close as he's gotten.
Philadelphia is built for that. Philadelphia is built to have these kinds of events and to have candidates here doing what they do. And honestly, I think a candidate with Fetterman's message fits in here. You know, when we talk about income inequality and all those different things that are important in his campaign, I think it makes sense to be here to talk about that.
But the thing is, and it's something that no one wants to talk about because the pretty big elephant in the room, there was an incident a couple of years ago where he pulled a gun on a Black dude that was jogging through his neighborhood.
Yeah.
And during the primary, that did come up as an issue. People did want to talk to him about that. And I'm guessing that might be part of the reason why his partisans are keeping him out of here. But you're going to have to answer the question. And most importantly, you are going to have to talk to the largest amount of voters in the state, which is southeastern Pennsylvania. You can't continue to avoid us and think you're going to win. That 10% is people who will vote, Democratic because they like what you do on Twitter. But the little old ladies in North Philadelphia that come out to the polls every single time, they don't know what you're about. They're not sure they trust you, and you need to come talk to them. Because Malcolm Kenyatta doing it for you is not going to cut it. You're going to have to do it.
Right. Lance, did you have something you wanted to get in there?
Well, one of the things I think we should consider is whether the money will dry up for Dr. Oz and State Senator Mastriano. If the next poll comes out after Labor Day showing them a 10% behind, I think that the national money is going to move elsewhere. They'll move to Wisconsin for Johnson. They'll move to Nevada to try and defeat the Democrat there, Mark Kelly. The last poll I saw showed Marco Rubio in trouble. Now, it's always hard to know how accurate the polls are, and I think Denise has a better handle on that. But I am surprised that Fetterman's campaign manager is from the Philadelphia region. He has run local races here. I don't understand. I don't understand why he doesn't get what Denise is saying. I think he does, and that makes it even harder to understand.
In fact, they get mad at me when I say it, particularly if I bump into one of them on social media. Oh, he just had a stroke. You're not being respectful of that. I am being respectful of that because if you can take your wife out to dinner, you can come to Philadelphia.
It's a campaign too, so you kind of have to do that. Anyway, so we do have to leave it there. We will be talking more about this as the year goes on. Next week on the show, we will have Councilmember Mark Squilla. And in the next few weeks, we're going to have a lot of guests coming on to give us a council preview of what's to come in City Council this fall. A lot to talk about in the next few weeks and few months, and it's going to be exciting. Thank you for being with us.